Over the last few years, as the topic and focus on recovery has dramatically increased, we've seen all sorts of different recovery type businesses and regeneration strategies being promoted, from cryotherapy to ice baths and stretching and just about everything in between. Now, while all these things can have their place, it's important to understand the bigger picture of regeneration strategies and how they work if you're going to incorporate them into your training and into your routines to help improve recovery. So my goal through this lesson here is to do that, and in the following lesson we'll talk about the soft tissue side of things. But when we get started here, it's important to understand there's kind of two big categories of how you use regeneration strategies, and every type of regeneration strategy is generally going to fall into one of these two buckets. Now, the first one is what I'd call relaxation type strategies. The goal in any relaxation strategy is to reduce that sympathetic tone or that stress response system, and then help the body get into a more parasympathetic or recovery driven state as a result. Now, these can be used frequently after any type of workout or just throughout the day. This is the basically, I'm stressed out, I need to turn that stress response system off, and then you do it by relaxing and calming everything down. Now, on the other end of that spectrum for regeneration strategy, we have stimulatory or stimulation type methods. And the strategy here is a bit different. It's using a short spike of sympathetic activation. It's doing something that actually is sympathetic, with the goal being that it's going to promote blood flow and circulation and then cause a parasympathetic rebound as a result. This is a bit of concept called hormesis. The trick here is you have to get that amount right. Too much of a stimulation type method, too much sauna, too much cold therapy, too much contrast therapy, for example, can cause essentially more harm than good, because it can cause more stress and actually slow down recovery. And this is typically what you want to be mindful of, and you're going to use these at different times, and you're going to use these in different circumstances. But again, there are a myriad of different regeneration techniques, strategies, modalities, all these things out in the market now. There's no way I can cover all of them, but I want to give you the framework so you understand the basics of what they are or are not doing, and ultimately how you can incorporate it into your program, into your routines as you go through metamorphosis. Now, we look again at these two broad strategies here. We can talk about some modalities that fall into the category. Now, soft tissue methods, which I'll cover in the next lesson, can span both of them, because you can use soft tissue treatments, whether you're doing them on yourself or you're having other people do them to you. They can be relaxing or they can be stimulating. You can have a nice relaxing massage that puts you to sleep, or you can have a massage that wants to make you kill yourself because it's painful. And those are very different effects on the body. Now we look at other relaxation type methods. These are again methods where our goal is to cause the body to immediately turn that sympathetic system off, or close to immediately. This is where meditation, relaxation, deep water floating, hot water therapy, those sorts of calming type strategies are doing exactly that. They're calming you down and allowing your body to turn off that sympathetic stress to get into the more parasympathetic recovery state. Now, again, on the other hand, we have things just like active recovery, which can encompass a bunch of different things. Things like cold water immersion and contrast therapy, which is a combination of that and the heat. Those are more stimulatory in nature. You feel woke. You feel a shock to the system, and that shock to the system is promoting blood flow, but it also will help promote a rebound of that parasympathetic system afterwards. Again, but the difference can be the devil's in the details and the dose there. So again, we'll walk you through the big piece of these, and then the follow-up lesson we'll talk more about soft tissue methods, because that's its own animal, and I want to talk more about diving into those different areas. So the big one here we'll start with is just active recovery, because this is one that's probably going to be the most common, because you can build it into your training, and it's already built into metamorphosis in the form of the rebound training workouts that are designed specifically for this purpose. So the reality is anything that's at low to moderate intensity for a fairly low to moderate amount of volume can be used as a form of active recovery. So walking, hiking, biking, swimming, different body weight exercises, breathing, mobility exercises, rebound training, as I mentioned, is just a form of active recovery, stretching, yoga, Pilates. There's lots of these. This is also where blood flow restriction training can come into play, all these sorts of things. Again, the goal here is simply to drive blood flow. You can use e-stim, which is another good tool there, because again, it's driving blood flow into the muscles without causing a whole lot of stress in the system. But anything that's generally speaking between about 30 to 45 minutes, somewhere in that time frame, and your heart rate for the most part is 70 to 80% your max, or Morpheus, you make sure you're in a blue zone. these things are going to be active recovery because they are driving blood flow throughout the body, which is a big piece of promoting recovery. They're helping with things like lymphatic drainage in different areas just by the movement, and they will help from a recovery standpoint if you use them, again, in this manner. If you go in and you do a 10 rep squat max, that's not really active recovery, but you can go in and do a body weight squat series to promote blood flow throughout the lower body and promote recovery. So again, active recovery is a valuable tool because it allows you to move in a wide range of directions and allows you to promote blood flow throughout the entire body. And that's the reason it's built into Morpheus or built into Metamorphosis, and something you can incorporate into really any type of training program to help drive recovery. Now, the other side of that from the active recovery standpoint would be more of the relaxation standpoint. And that is where having relaxation at home is going to be something you're going to want to take and do on a regular basis, because ultimately, again, when you're training, when you're out in the gym, when you're doing your job and all these things, you have stress. But when you're home, you need to be able to shut that stress off, and as much as you can at least. So this is where having some sort of relaxation room in your house, somewhere that's dark, somewhere that's quiet, somewhere you can spend 10 to 15 minutes a day in, can make a big difference. So it's just being able to take a break outside of your normal routines and shut down and allow that sympathetic system to turn off. So this is where really, again, being dark and being quiet makes the biggest difference in allowing your sympathetic system to just calm down, turn off, and allow your body to get in a more recovery-driven state. Now, there's also tons of apps out here. Over the last few years, there's been just as many new apps as anything else. So there's millions of them. My suggestion, try the ones that you've heard most about. Headspace, Calm, all these ones are out there. Find one that works for you, that you can use consistently and that you feel is beneficial. And they can help. Like I said, they can just help make you focus on that. With, if nothing else, just spending time doing it is beneficial. Now, the other thing, just making a habit of using music, light therapy, these breathing drills, all these different things into your daily routine is a really good way to improve your regeneration and recovery. Again, it's got to be habitual. That's where building the right habits and routines across your lifestyle will carry over into this area, because again, if you take a 10 or 15 minute break out of your day every single day to go through one of these processes of driving recovery through meditation or relaxation, you will see a benefit of that. But again, if you don't do it habitually, if it's every once a week, it's probably not going to have the same impact. So it's a really, really good thing to get into the habit of doing these things on a consistent basis, because you will get the better results versus doing them very inconsistently without any habits driving them. And then also using heart rate as biofeedback is a really valuable tool, because ultimately your sympathetic system is driving your heart rate up. So if you can use heart rate and work on all these different breathing and meditation and all these different exercises to drive your heart rate down, that's a good sign that whatever you're doing is working, that you are finding it relaxing, physiologically speaking. Because if your heart rate's going down, it means that parasympathetic system is more active, and it means the sympathetic system is less active. So using heart rate as a feedback mechanism, a feedback tool, a biofeedback tool, is valuable, because again, it can help you develop this skill set of being able to relax. And make no mistake, relaxation is a skill set, and some people suck at it and some people are better at it, but it's trainable. So like anything else, if you're not good at relaxing, it's something that you want to focus on, not just for recovery purposes program, but because it's important to your overall health and wellness as well. Now, a bit less practical than that for relaxation is deep water floating and swimming. And obviously this requires a pool. But if you go to a gym that has a pool, or you're fortunate enough to have a pool yourself, deep water floating and swimming can make a big difference, because when you get in the water, you unload the body in a lot of ways from where it's in normal life in gravity. It has a lot of benefits because of that. So if you can get into a pool, specifically if you can get into a pool that's at least 8 to 10 feet deep and float, it can unload the body and promote relaxation. 10 to 20 minutes of just floating. If you can't get any sort of buoyancy, you want to get out of the deep end, but you want to give yourself something that makes you buoyant. So any sort of floaty or device that helps you float if you can't float without them is really important. And then this is something we did with common combat athletes for years, would alternate between floating and some lap swimming to drive blood flow even further. And something as little as 10 to 15, 20 minutes in the pool, I found over the years can make a really big difference in promoting recovery, just because, again, the body is under constant stress of gravity, and a lot of muscles are having to just resist gravity. But when you put yourself in the pool, that all changes dramatically. And you also get the proprioception from the water surrounding your skin. There are a lot of benefits to being in the water, and this deep water and floating and swimming, again, if you have access to a pool, is a really, really good strategy to promote recovery and regeneration. Next up, cold water therapy. This is obviously one that's been around for a long time. It's very popular. It's got different benefits. The biggest thing is here is more and more research is showing this pretty definitively now. You don't really want to do cold water therapy after strength training or explosive lifting, that sort of thing, because it can have negative effects and basically negate some of the gains. Now, it's more reasonable to use it after conditioning sessions, although I would caution against using it excessively. Generally speaking, it's going to reduce your core temperature. It's going to reduce or potentially reduce some of the inflammation. But again, it can be a double-edged sword. If it's used too frequently, if it's used in the wrong circumstances, it's probably not going to have benefits. Now, it doesn't mean if you love doing your morning ice bath, I'm not telling you not to do that, but I would try to avoid doing it consistently after training, specifically after strength training. So, usually 1 to 3 minutes of cold, 2 to 4 minutes of recovery is a good way to do that with 2 to 3 repeats. And that's the other thing with cold is more is not necessarily better. Remember, it's a stressor because it's so cold, and doing a lot of it isn't necessarily going to make it better or more effective. It can make it less effective. So in general, like I said, there are uses for it, particularly if you're out training in high, hot, humid type environments and you're overheating. It can bring the body temperature back down, and that can play an important role in speeding the recovery processes up. But again, not for the strength training side. It should not be used in that case. And again, make sure you're using it judiciously. I don't think using it after training, any type of training over and over again is probably the best strategy. So just keep that in mind. Now, hot water therapy, on the other hand, is a bit different. Parasympathetic regeneration or stimulation. And the biggest difference here is, again, it's helping that body turn on the parasympathetic system, which promotes relaxation both mentally and physically. It's if you feel more relaxed as you're in hot water, there's a reason that you feel that. It's also increasing the blood flow without putting a physical stressor on your body, because the heat is driving body temperature up and promoting blood flow as a result. So research here has shown about 102 degrees Fahrenheit is what you want to drive all that. If you're significantly below that, it's probably having much less of an effect. If you can get full body in, that's more effective than just your arms, your legs, or whatever. And usually 15 to 25 minutes is about what you're going to want to do. If you start going much beyond that, again, you can have the same negative effects as doing too much of anything else. It's not necessarily better, it's worse. So again, this is also an individual thing I found. Some people respond very well to hot water therapy. They find it very relaxing. It is relaxing to them. They see a good balance in their HRV and they feel better afterwards. Other people simply don't seem to respond as favorably. They don't like it. They're not as comfortable in it, and it doesn't have the same benefits. So it's something worth pointing out here. If you hate doing something and you don't feel better doing it, it's probably not helping you, okay? It's probably not actually improving your recovery if you are stressed out and unhappy doing it, because again, part of the process needs to be turning off the stress system. But if you are stressed out doing something that's recovery based, it's not recovery. So just keep that in mind. Find things that you personally enjoy doing and like that process, and you will be much more likely to actually benefit from it. Now, that also applies here to contrast therapy, which is just, as most people are aware here, a combination of the hot and cold alternating. Typically, you're talking about 2 to 3 times to 1, the hot to cold ratio, and 2 to 4 times, you're probably going to repeat that. The biggest thing here is the bigger temperature differential you can get between the two, the more effective it's going to be. It's basically a central nervous system and autonomic nervous system shock to the system. It's a clear range of stress that you're imposing the body in a short period of time, and it will respond accordingly. And basically, again, you're trying to get this parasympathetic rebound out the whole session is over. And again, if you do it correctly, you will feel a relaxation after you're done with it. Of course, it's going to wake you up and jolt you while you're doing it, but that jolt causes that parasympathetic rebound afterwards. And again, you're not putting your body under physical stress in the same way you would with lifting, but you're increasing blood flow as a result. So again, this is another one of those things. Be careful, and be mindful of when you do it. You can definitely go overboard trying to do contrast therapy all the time. I will say the hot cold showers is a very mild form of it, because you're not submerged in the hot and cold water, and the water is not as hot or as cold as it can be with true contrast therapy. So yes, you can do hot cold showers every day, but there's a questionable, I would say, degree of how much those things are really impacting you, just given the fact that you're running water over yourself and you're not immersed. But again, if you feel better and it's helping you get the right mindset for the day and all these sorts of things, you love doing it, I'm not telling you not to do it. I'm just telling you there may be other ways to incorporate this type of training more effectively, or other methods that may be more appropriate. So just keep that in mind. And then really what it comes down to here is choosing the right regeneration methods, because again, every tool has a use. So you want to use a variety of different stimulation methods to improve your resilience by teaching your body how to adapt to different kinds of stress, which is why I don't recommend just using one method over and over again. There's value in exposing the body to these different types of stressors, whether it's heat or cold or other types of stress that the body has to adapt to. It's good to use a variety. So don't stick with the same method indefinitely just because you like it or you are comfortable with it. Use a variety of these things so the body can get better at adapting to more types of stress, which makes your body overall more resilient, and it's going to allow you to do a variety of different things and accommodate to that stress more effectively. So the other thing, typically, like I said, 2 to 4 weeks is where you're going to want to spend time on one method before you change it up. So again, you don't have to change every single time. You don't have to go contrast one day and then cold therapy another time and then do contrast therapy or have this elaborate schedule. But generally speaking, rotate things every few weeks, try some new methodologies. The ones I went through are certainly not all that there are. There are all types of different regeneration strategies. And, I often get questions, does this work? Does that work? And the biggest thing is try it for yourself and see. You can use HRV to measure it, which we'll talk about in the last lesson of this module. And you can just see how you feel afterwards. Placebo is an effect. If you feel better, maybe it didn't do anything for you, but it made you mentally feel better. And that in itself has a benefit. So how you feel often will translate into how you recover when it comes to this type of work. So keep that in mind. And then again, incorporate the relaxation strategies as necessary to recover from stress faster. But all of these things are a secondary nature to everything else we've talked about up to this point. So getting your sleep, getting your nutrition, getting your training dialed in, all of those things are the most important. Those are the foundational pieces of recovery. Regeneration strategies are the icing on the cake. So just like you can't out-train a bad diet, you can't out-regenerate a bad training program, lack of sleep, or poor nutrition. So I just want to point that out. I've seen a lot of people have fairly poor programs put together. They think they can get away with training high intensity 5 days a week and then make up for it by doing ice plunge or by doing contrast or whatever. Again, the reality is these things are going to be icing on the cake in terms of helping with recovery, but they can't make up for a bad diet, bad nutrition, or lack of sleep. So just keep that in mind. So anyway, I hope that helps. And next up, we're going to dig into the soft tissue side of things because, again, at the end of the day, we are moving, we are stressing our soft tissues, and it's really important to take care of them, make sure our soft tissues are recovering and regenerating and keeping us moving, healthy, and getting better.